Good afternoon, everybody. Welcome back. Dr. Blumenthal, Natural Transplants in the Bethesda office, and we are here excited to have Stephanie with us. Stephanie, welcome.
Thank you.
How are you feeling today?
I'm excited and slightly nervous, but I'm more excited.
Okay, good. Excellent. We'll walk you through today. Today will be a fun day. Thank you for doing this for everybody and sharing your story. If you wouldn't mind, sharing with everybody why you're here, what brings you to us today?
I realized over several years, as a result of just getting my hair braided back to back to back without any rest and the weight of having locks, it took a toll on my hairline and it became noticeable. So after doing some research and surprisingly finding out that natural hair transplant surgery exists for African American women, I decided to take matters in my own hands and get it corrected. Awesome.
We love having you here. That's fantastic. I'm gonna have Whitney just zoom in a little bit so we can take a closer look. And I would consider yours in the mild range. Obviously, there's patients with worse hair loss, but it's bothersome to you, and you hide it relatively well. But when you pull it back, it's a little more visible. Mm-hmm. You have incredible hair for this. I'm really looking forward to this. I think you should get great results. We'll draw everything out, do a little bit of shaving, and then we'll check back in a few minutes. Sound good? Awesome. All right, we'll see you in a little bit. All right, everybody, we are back with Stephanie, and as you can tell, we have drawn out the hairline and done a little bit of shaving, which you did great with, by the way. And so we didn't really recreate anything. We just drew out her old hairline. There was an outline there, very easy. She liked her old hairline, and so we just replaced it. Looks nice and subtle, but still doing a lot. And so I think it looks really good. And then we drew out, just shaved out the back as well too. This is where we're going to be taking the strip from. And we're going to head to the other room and start. We have a couple of Valium on board. How are you feeling now?
I'm feeling pretty good.
Doing all right?
Yeah.
Excellent. We'll head next door. We'll start the procedure, and then we'll check in with you a little later.
All right.
All right. See you in a few. All right, Stephanie, we are in action here. We're winding down, only about probably 5 minutes left, 10 minutes left. How you feel?
Feel pretty good.
Doing all right?
Yeah.
You look very comfy, cozy.
I am.
We had lunch, listened to some Motown all day today.
We did.
You having any pain or any discomfort at all?
No.
Okay, awesome. Well, we will be done shortly, and then we'll go over all the instructions, and then we'll do another video and catch up with you at the end, okay?
Okay.
All right. All right, Dr. Blumenthal back with Stephanie. We are finished. Congratulations.
Thank you.
Be honest, how'd the day go for you?
It wasn't bad at all.
Good. What worst part was the numbing shots, I assume?
Yeah, that was it.
But you did fine. I didn't hear any screaming or yelling or anything like that. So
No,
you did well with it. But like I said, you had some lunch, listened to some music. You looked pretty comfortable most of the day. Mm-hmm. It looks great. It looks really great.
I'm happy with the way it turned out.
I like the line. I'm going to zoom in a little bit so we can kind of see. You can see we had enough grafts to fill it all in, which I wasn't too worried about. Side there, nice, subtle, but still a lot. Mm-hmm. Nice clean look on it, and then we can come around. This is the incision in the back, and that's going to blend in really well. So overall, I'm thrilled. Hope your day was, as pleasant as possible. Any recommendations or sort of words of advice for anybody else thinking about it?
I would definitely encourage anyone who's thinking about having it done to go ahead and get it done.
Yeah, awesome. Well,
it's worth it.
I appreciate you sharing your story with everybody. Hopefully this will inspire some other people and help some other people. And hopefully we'll follow you along and see you in a year and see what it looks like.
Sure.
Awesome. All right. Take care. Thanks a lot.
Thanks.
Bye-bye.
Call us now, 844-327-4247, and ask about our Hue and Hue Plus procedures, which move more hair than ever before. Hope to hear from you soon.